Hey guys, this is Dr. Jason Schumard, owner and director of Integrative Wellness Center of San Diego, and author of How to Reverse Your Diabetes and author of The Thyroid Epidemic. So today I wanted to focus on something that is really, really important. I've just been hearing so many things coming up in the world these days and things around here locally in San Diego. And I thought it'd be a really good idea to do a really important topic on, sick care versus wellness care. Now, a lot of people think they understand the difference between the two, but I want to really focus on the specifics of each one to make sure that you know exactly what is going on, the things that you can do today to protect ourselves. We are living in this incredible amount of fear that's going on, not only from the specific virus, but what's going to happen to us. Are we vulnerable? There's lots of things that are going on, and in my opinion, it's causing more harm than good. And I want to give you some options of what you can do right now to protect yourself, to make sure that you and your family stay safe over the holidays, over this type of season, and what's really going on as an epidemic right now in the state of our country and locally as well that's going on. So, but before that, I really just want to give just a quick testimonial of another one of our patients recently who had an amazing job. This individual, when they first came to our office, they were taking multiple different types of medications as a diabetic patient, very unhealthy, just complaining about being tired all the time, not sleeping well, just not feeling right, and things are just not going the right direction. We've been working with this person for about the last 2 months, and we've ran some new testing on them just recently, and it was pretty incredible. Their hemoglobin A1C came down from an 8 all the way down to the low 6s. They've already reduced half their medications, so they were taking 3 different types of medications. They're off one of them. The second one, they're halfway off of at this point, so they're starting to have more energy. They're starting to sleep better. This individual is just incredibly coming out of their space now and just feeling so much better. And these are the types of things that we see happen every day in our office. We rarely ever see a patient fail. Again, we work with multiple types of conditions: type 2 diabetes, thyroid conditions, autoimmune diseases, and of course, cognitive decline, which is dementia and Alzheimer's. So if you know of anybody who is suffering from those types of conditions, make sure they watch these videos. Make sure you move them in the right direction to our YouTube page or our social media, so you can watch these videos. I'm constantly putting out this type of content of how we help so many patients in our office recover to get back into this wellness model rather than being stuck in the sick care model, which is what I want to focus on today. So what many people believe is that they are doing things right now to keep themselves healthy and well, and they base that off of how they feel. So if somebody feels good, they say, I'm healthy. Well, that unfortunately is a bad way of looking at things. If we compare our bodies to cars, when your car is not working properly, the check engine light comes on. Now you can take a look at that check engine light and say, I don't really want to do something about this. So you can cover that with tape if you wanted to, really. But the reality is whatever's going on in your car is going to get worse over time, but your car can still get from point A to point B, right? Maybe not as efficient, maybe it's a little sluggish, whatever's going on, but it can still do that. Well, our bodies are the same way, and unfortunately, it doesn't become a problem until we get symptomatic. Well, if we use the same example, when your car becomes symptomatic, it's breaking down. It's not working properly, and maybe now you need a tow truck or whatever else. Well, your body's the same way. When symptoms start to happen, it's already broken down. The problem is already there. So if we judge the way we feel based upon our health, it is going to be very difficult to ever be healthy, truly healthy, and to be in this wellness model. See, most of us are in this sick care mindset because this is what we're being bombarded with. All the commercials that you see, there's tons of pharmaceutical commercials. We're being told, oh, I feel good, you must be healthy. Unless you have symptoms, unless you have a fever, a sore throat, whatever else is going on. But even right now, we know there are people who aren't experiencing any symptoms that are still carriers of these types of viruses and everything. Well, this has been known for many years. It just has never been as much of a situation as it is now, which is why I think it's so important to understand the difference between sick care and wellness care. So let's talk about that. So let's go over some examples of what sick care would look like. So in regards to sick care would be things like symptoms, right? So symptoms, that can be a headache, a fever, a runny nose, right? Just kind of feeling icky all over, feeling crummy. That could be things like high blood pressure. That could be things like, low blood pressure. It's not as common. Increased blood sugars, right? That can be things like pain is a symptom, right? Joint pain, shoulder pain, arm or muscle pain. Those things are all going to be symptoms. This can be a cough, can be a runny nose, etc. Right? But it could also be something like a fracture or a broken bone. It can be bleeding internally, right? Those sort of things. Now, if you're having these sort of symptoms right now, you're in this sick care model. So we've got to do everything we can to reduce those symptoms, to get those symptoms away from it and get your body into a better state. So if you have bleeding going on, well, now you're not worried about being well. You want to stop the bleeding. If you have a fractured bone, you want to get the bone healed as quickly as possible. Or if you have increased blood sugars that are at massive 300, 400, 500, you got to go do something about to get those blood sugars down, and some things that can help you with decreasing pain as well. But what happens when these symptoms go away? See, for most people, they believe, well, when the symptoms go away, I'm now healthy. That's not true, because whatever got you to this point to start having the symptoms is still there. So if somebody had elevated blood sugars of, say, 400, they still have diabetes. If they have extreme pain from a specific problem, like a broken bone, for example, yes, you can go in and get the surgery or a cast, but you have to do things afterwards to get those healthy as well. Well, the same thing happens in regards to all other types of things like chronic degenerative diseases. See, medicine right now will tell you that they're going to be treating your chronic degenerative diseases, right? And those are going to be things that are long-term things like autoimmune diseases, thyroid conditions, diabetes, those sort of things that you may be taking medications for. If you ask your doctor, how long are you supposed to take these medications, they're going to tell you, for the rest of your life. What do you mean for the rest of your life? No, it just means that they're not truly understanding what's really going on and what's causing the problem. See, these symptoms are all coming from something. So we have to first eliminate the symptoms, whatever that might be. Maybe it's with a pharmaceutical, maybe it's with some work at the emergency room, whatever it might be. We have to get past this component. But then once that's done, then we start to go into the next step of this healing process, which is wellness. And wellness care is ongoing, right? You never stop feeling and doing things for your body to stay well. So once those symptoms go away, now we have to go into and understand what is causing those symptoms. What was causing those symptoms? So this sick care is an emergency state, and wellness is getting your body back to being healthy. So if you go into the hospital because you had a heart attack, you go in, they patch you all back up, get you all back together, and then you leave the hospital because they're saying you're now stable, check in with your primary care physician. If your mindset is, I'm good now, I am healthy because you don't have those symptoms, you're not being told or not thinking properly. Because whatever caused the heart attack is still